So New South Wales recorded 3 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 8 new cases acquired overseas, bringing the total to 4,829. Of the 3 new locally acquired cases, all 3 are linked to the Berala cluster, a woman and man in their 30s, and a child who are close contacts of a previously reported case. These 3 cases are linked to a man and woman in their 30s who were included in yesterday's numbers, and we're investigating a potential exposure at an event on the 29th of December. This event is not the same as the one mentioned yesterday, in which a positive case initially failed to recall. That event took place on the 27th of December, but clearly this contact tracing flows from those events. As the Premier had indicated, there was a person overnight diagnosed in Mount Druitt Emergency Department. He was a gentleman in his 40s. A household contact of his, also in their 40s, has also tested positive. What we are doing as a precaution, he did spend some time in the emergency department whilst awaiting the test. As a precaution, we are ensuring that all staff or patients that may have had inadvertent contact are assessed and appropriate public health measures put in place. The emergency department has been extensively and thoroughly cleaned and is now coming back online. So just want to thank the cooperation of the residents of that area and local GPs for that impact on the service. In terms of testing, there's 18,570 tests were reported to 8 p.m. last night, compared with that 23,763 in the previous day. It is essential at this time that we strive for consistently over 25,000 tests, and I would like to see more approaching 30,000 tests as we push to get no community transmission. Also, I would like to enlist the support of general practitioners across the state. We know that general practitioners are very important as often pillars of the community in reaching out through your community links, but also in the day-to-day practice. So please encourage all your patients to get tested. If they're ringing up for advice, please ensure that they're advised to go and get tested with the most minimal of symptoms. As I said, it is critical at this time that we achieve over that, up towards that 30,000 tests per day. Particularly of interest is those areas in southwestern Sydney and Western Sydney. And please, again, be vigilant for those new venues that are coming up online. I'm just going to mention a couple of them that we want to call out, and this relates to a public health alert that was issued yesterday. A number of new venues in Sydney, southwest and inner west were visited by confirmed cases of COVID-19, and this is publicised on our health alert last night. Anyone who attended the following venues at the times listed below is a casual contact who must be tested immediately and self-isolate until a negative result is received. And if any symptoms appear subsequently, get tested again. The Tai Hung Supermarket on 307 to 309 Illawarra Road, Marrickville, on Thursday the 31st of December, between 3:45 p.m. and 4:45 p.m. The Bankstown Central Shopping Centre, in particular the following stores: Target, Myer, Smiggle, Big W, Best and Lest, Oporto in the food court on Wednesday the 6th of January between 11:30 and 2 p.m. And Bankstown Central Shopping Centre, in particular the following stores: Big W, Smiggle, Oporto in the food court on Friday the 8th of January between 1 and 2:30 p.m. And Bankstown Service New South Wales at 350 to 351 North Terrace, Bankstown on Friday the 8th of January between 11:45 and 1 p.m. There are also a number of other venues on the New South Wales website, government website, so I do urge members of the community to regularly check that for updated information.